So welcome everyone to this webinar of the Global Observatory of Long-Term Care. My name is Adelina Gomez Herrera, and I'm going to give a brief introduction to the observatory and our next webinars. And and maybe I can share my slides. So the Global Observatory of Long-Term Care is a platform for cross-national learning to improve and strengthen care systems. It's part of the International Long-Term Care Policy Network. And our goal is to share what we've learned about how to address key challenges on long-term care, showcasing how different countries and localities are addressing them. And as in today's webinar, share research evidence and facilitate collaborations. And this is open to everyone. The way that the observatory works is that it's powered by people's willingness to share their work and knowledge, and we can do that through, we have our own publications, including a blog where we now are sharing more and more results and findings from research projects. We have methods and topic guides, country system profiles, and the real heart of the observatory are the interest groups that organize webinars and share relevant publication and resources. And we are gradually building up a publication and a database with now almost 800 experts on long-term care, all listed by country, topics and methods, publications, research projects, and I also have now an extensive library of previous webinars that you can also search by topic, country, and methods. In terms of our next events, we have one on the 11th of March on home-based care outcomes, some evidence from the US looking at whether the type of provider matter. We have another one that I think may be relevant to many of you on the 24th of March, looking at social connection in care homes from the SONET study that's going to be looking at how to measure and how to improve social connections in care homes for people with dementia. We have one on the 31st of March on the challenges faced by women in the social care workforce, focusing on gender and race intersectionality in training reforms, and that's with evidence from the UK. And then we have one at looking at the outcomes for private versus shared rooms on nursing homes in the US, and focusing on health outcomes in particular. And I'm also very happy to announce that we now have the call for abstracts for the next International Long-Term Care Policy Network Conference, which will take place in London on the 9th to 11th of September. And yeah, the call for abstracts is open, so you're all very welcome to join us and submit your abstract. So that's all from me. As I said, I'm really happy to have these collaborations between interest groups. Today is a collaboration between the Qualitative Interest Group, Methods Interest Group, and the Pain and Care Homes Interest Group. And I'm going to hand over now to, I think it's to Chiara, to say hello from the Qualitative Methods Interest Group.
Okay, hi everyone. My name is Chiara De Poli. I'm a research fellow at the Care Policy and Evaluation Center at the London School of Economics. And I've started the Qualitative Research Interest Group for the observatory. And the group does what it says on the tin, really. So we talk all things qualitative research. And we are fairly inclusive in the research methods we discuss. We'd like to discuss the population groups involved in qualitative research and different approaches and research settings also qualitative research. We are also keen to push the boundaries, I guess, of what qualitative research does or could do. And I think today's presentations are going to be fairly interesting in that respect, since we are going to see how participatory approaches in research can be used in care home settings involving care home residents and care home staff as well. So that's what we do. Please keep an eye on the website, on the page of the interest group. More webinars will be announced soon. Manu, do you want to go next?
Yeah, thank you, Chiara. My name is Manuela Hödel, and I'm from the Institute of Nursing and Health Science at the Medical University of Graz. I myself and my colleague, Professor Sandra Zwack-Harlan, we created that group 2 years ago because we are both, or she and me and another colleague, we are all three focusing on pain in care homes. So we thought about exchanging ourselves, so we three, but across our boundaries in the universities and informal networks, we wanted to establish that. And I think it was really interesting, the last webinars on assessment management and things like that. I was very pleased that Chiara came up with the idea of a shared webinar, because for myself, I'm more a quantitative researcher. And now I have the possibility to look into care home research from a qualitative perspective, from persons that really have expertise in that, from Pat Schofield and Rena Davey. So I open the floor first to the first speaker, to Pat Schofield, and she will talk about what matters to care home residents, staff, and how to engage them really. So Pat, the floor is yours.
Thank you, Manu. Let's try and share my screen. There we go. Okay, success.
Yes.
So, thanks very much for asking me to talk today. I'm very passionate about participatory research, and I really like to emphasize real participatory research. So there's lots of terminology in the research world that we use that alludes to engaging with people with, in my world, it's people with pain. But I want to focus particularly on examples of how we can really engage with people, as in getting them involved in the research themselves. So rather than just acting in an advisory capacity or consulting on aspects of research that we do. And this is where I come from. I'm a professor of clinical nursing at the University of Plymouth, and I'm also National Institute of Healthcare Research Residential Care Settings Lead for the Southwest Peninsula. And what that means is that I engage with care homes across Devon and Cornwall, the Southwest Peninsula, to try to get people involved in research. So my talk is going to give an overview of what is participatory research versus public engagement. And I'm going to give you some examples of some of the studies that I've been involved in, which have focused on working with specifically older adults, including working with older adults and carers in care home settings. So we have, certainly in the UK, we have been talking a lot about public involvement in research. And over the past 10 years or so, there has been a huge focus on bringing in participants, or the general public, if you like, to get more involved in research. So the National Institute of Health Research, who funds most of our research in the UK, it's government funded, have over the past 10 years or so developed strategies to enable us as researchers to have these guidelines, if you like, about engaging with participants more thoroughly, more effectively. And the guidelines include things like how to engage, how to recruit, and importantly, how to provide support and resources or payment to make sure that people are correctly identified and rewarded for their valuable time and input. So public involvement was the terminology that I suppose originally came out. It was about carrying out research with members of the general public in an active partnership. So the research is done with or actually by members of the public, rather than doing research on them or to them or for them. So it takes away that paternalistic approach that we often have, that we know best about what people with certainly pain want or need. Public engagement is another very different term, and that focuses on sharing information and knowledge about research with the general public. And we've done that quite well for many years. So we have seminars and webinars now with the general public to share the research that we are doing in our everyday lives, to make them aware of what is happening in the research world. And I think that's driven a lot in the UK by our research assessment exercise, which encourages us to look more at impact. So what is happening to the general public as a result of the research work that we are doing. Now, participatory research actually focuses on the process of sequential reflection and action, and it's carried out with and by local people rather than on them. So what we do is we engage with local people in the communities to find out their knowledge and perspectives, to enable us to actually develop the research from the very start. So that's very different. It's more engaged, more driven by the general public. Where this all started for me was with Flossie. And a number of years ago, I had funding from the Economic and Social Research Council to develop some seminars to engage with older adults. And what we wanted to do was bring together older adults in workshops and find out what was important to them for research. And I was working in Scotland at this time, so we put out a call across Scotland, and we had around about 50 participants came forward, which in itself was really exciting, because this was older adults from all over Scotland, which is fairly rural in a lot of places, but they came from afar because they really wanted to engage with us, to talk to us about what was important to them. Now, as a researcher, I had some preconceived ideas, and I thought how good it would be to get our older population using WeFit. I don't know if you know what WeFit is, but it's a platform that you stand on with a remote control, and you engage with games on the screen, on the television. And we thought, wow, this would be a really good idea, because our older adults could stand on this platform and engage with games and things on the television screen, and that would help with their balance, help with their mobility, and so reduce their pain. Our group of 50 or so older adults were mortified. They thought this was the worst idea ever, and told us not to go there at all. We don't want to get involved with this. It would be terrible. We would be terrified of falling off the platform and injuring ourselves, and we don't think it would help with our pain at all. So for me, this demonstrated how important it is to actually listen to our older adults from the very start when we are planning to do a piece of research, because some of the ideas that we have in our ivory towers are not what people are really looking for. So we completely abandoned that idea and decided not to do the research in that area at all. Interestingly, though, a few years later, I saw Flossie in a newspaper. And Flossie, living in a care home, was using the Wii Fit. So I think that just shows that you can't assume that even our group of older adults that we're working with want to engage with or don't want to engage with what we're recommending. So they're not homogenous is what I'm saying, I guess. So there's various forms that participatory research can take. So you can engage with communities or groups of older adults, and you can sort of reach out to diverse groups of older adults, so different demographics, and you can bring them together in this sort of different approach, so action research approach or community-based research or citizen science where the population actually engage with collecting the data. So there's various forms. The other form of participatory is what we call emancipatory, which is even a step further, where the older adults themselves do all of the data collection. I keep referring to older adults, sorry, that's my field, but this can apply to any adults or any population. So the steps to participatory research, and this is where I'm very keen that we do follow this pathway, because I see examples of people describing participatory research, but they miss out one of the key steps. So the first step is to recruit volunteers, and that's people with the lived experience. So people who have chronic pain, for example, or people who are aging, as another example, or children, or whatever field you're working in. Now, the important thing for me here is to provide training in research methods. And I think this is the step that people don't always offer. So this enables our participants to be on that equal footing. So they understand some of the terminology that we might be using, because as healthcare workers, we have our own language. As researchers, we have our own language. So we have a training course that we offer, and it's usually a couple of hours training to give the participants some understanding of some of the terms that we use. So, for example, mixed methods, qualitative, quantitative, etc. And then we take that training a little step further to help them to understand what the research we are thinking about doing, so that they can input on the development of that research. And an example at the moment is our adults that we're working with have developed a sort of terminology checklist. So they themselves have picked up on some of the language that we use and developed this sort of checklist that can help others to understand what we're talking about. And that's a really important step. And then we share the information about our planned study. So this is what we'd like to do. Going back to the story of Flossie, it may be that at that stage, our participants say, no, we don't want to do this. We don't think it's a good idea. But what they also do is to provide really good feedback on, maybe, have you thought about this? Or have you thought about going a different way? And then we engage our participants throughout the whole research process. And that's why we have what we call our advisory group, who come on board, and they meet regularly every month or so, and they give us feedback on what we're doing and, any suggestions that they think we could use going forward. And that's the group that I'm currently working with, who've developed the terminology checklist. Just to give you some examples, one of the early studies that I did then was looking at the use of technology. And this was about developing a chatbot for older adults to self-manage their pain. And if you sort of look at the literature, I admit this was a few years ago. So a few years ago, the literature tended to say, you know, older adults won't engage with technology. But actually what I did was I worked with a number of pensioner groups in South London, in Lewisham and Westminster, etc., to talk to them about, well, you know, what's stopping you use technology? Would you like to use technology? And this helped to shape this study looking at the use of chatbot for self-management of chronic pain. The SRC participatory workshops, as I've talked about, that was the one that sort of came out with the Flossie idea. So this brought together, as I say, we had 50 plus participants came along to these workshops. And from those workshops, we developed some smaller groups who were actively participating in the research development. And then we developed this much larger 4-year program of research with our older adults to develop interventions to self-manage chronic pain. So showing how participatory methods could shape meaningful interventions. And there was a number of things that we did within this study, but the participatory bit, we actually recruited some of our older adults from this larger group to help us to search the literature. So this was really exciting. The older adults, there was about 6 of them involved, would go around and look out the literature around chronic pain. And they'd go to pharmacists and look at, you know, what leaflets were available. They'd go to GP practices. They would surf the internet. And they came up with recommendations about what literature is appropriate for self-management of chronic pain. And what they then did was developed these leaflets. So one of the leaflets was about how to find information, because what our older adults were saying to us was that they struggled to find the information on the internet, that it often, as we all know, you end up going off in all sorts of directions, and a lot of the websites have gone or been closed down or moved. And so they developed this leaflet to enable other older adults to find available literature. They also developed a second leaflet that was about how to self-manage pain as well. So some of the things that they recommended from their review of the literature that could be used to manage chronic pain themselves. And the third thing that they developed was an information on how to share information to grandchildren. So this was a how to explain chronic pain to grandchildren, which was identified as a problem for the older adults. Another study that we've been involved in, again, this was a community-based study, but it was a co-design led by Bradford, their dementia group, looking at co-designing interventions to self-manage pain in the community. So again, same format, training older adults to develop strategies to self-manage chronic pain associated specifically with frailty. And then we had this study that we did specifically in care homes. So this was working with people with dementia, people who care for people with dementia, informal carers, family members, and healthcare professionals, including pain specialists, geriatricians, and dental practitioners, we were aware that dental pain in care homes was an unrecognised issue that wasn't dealt with very effectively. So we wanted to talk to these groups. So we brought together these representatives into a workshop, a number of workshops actually. We ran 4 or 5 workshops to talk about what were the issues related to dental pain. And we did, although we only did this study over a 12-month period with care homes, we did identify the next steps, if you like, for future funding. So these were some of the things that our residents, our carers, our healthcare professionals identified as being important for the care of dental pain and preventing, if you like, dental pain. So on the left, we've got things identified by older adults with dementia and their informal carers. And on the right, we've got things identified by healthcare professionals, dentists, etc. So you can see some of the important issues that were identified by residents, carers, informal carers. So mouth care, reminding about mouth care, fear of using toothbrushes, dementia-friendly dental services. One of the things that our care home managers identified was the fact that if they have an issue with dental problems with residents, that they often transfer the resident to hospital, which of course makes the dementia even worse. So they changed practice to bring the dentist into the care home setting. So these are things that change our way of thinking about how we carry out research into particular problems. That is important for the individual, the person with dementia, and the carer, the informal carer. The important thing is, and the parent study was the dental study, is to evaluate the involvement of the patient or general public, and that is to identify that they are feeling involved and that it is meaningful engagement, that is the topic relevant and important to those stakeholders, and that might involve the flossy change to direction. So we might have to think about the direction that we're going and change it. Were our methods accessible and facilitate broad representation of stakeholders? So that's about that taxonomy of terms that we use and about appropriate training for people who we want to engage with. It is challenging. I'm not going to say it's not challenging. It is sometimes challenging to engage with different groups. And so we have to work hard to make sure that we do engage. And any benefits to participants. So we evaluated their experiences. Did people feel they were listened to and respected throughout the process? And were there other ways of seeking feedback? And could we design studies in a better way to help us going forward? And was it a useful and valuable experience? And of course, to go back and find out at the end of the study if our outputs reflect what the older adults themselves were expecting. The National Institute of Health Research have promoted this framework known as PIAF, which is about evaluating people's engagement with research. And there's lots of publications on the website which has used this approach. So what are the values? Do our values, are they acceptable to the group that we're working with? Is the approach that we use acceptable to our participants? And the research focus and design, do they understand? And is it appropriate? Are the practical issues that we need to consider? So that's about sort of engagement, how we engage with participants. Going back to the Lewisham group, we had face-to-face meetings. We had face-to-face meetings with the Aberdeen group. With the dental pain, the care home groups, we used online, and both work quite well. But of course, some people may not have access to online. So those sort of practical issues. Payment for time, payment for carer support is important. And impact of the research and to the participants themselves. So it's all very well engaging with people in research, but we don't just then finish the research and move on and leave them. That's the end of it. Thank you very much for your time. We need to make sure that we continue to engage. I just wanted to finish with this positive aging, and this was research that I was involved in again a few years ago around positive aging, and from that I learned that, you know, older adults are very keen to be involved in helping us to design and implement the research. And these ladies were the fabulous Fashionista group. If you've never heard of them, go onto the internet, put fabulous Fashionista, and you will see the films of this group. They were involved in research with us in the University of Greenwich. So it's important to engage with our participants or potential participants, and there are organisations who can help us with recruitment if you're struggling. The National Institute of Health, for example, have a repository of over 7,000 people who are interested in getting involved in research in the UK. It's important to listen to what they're saying as well. So, you know, those preconceived ideas might have to change. To respect our participants and to evaluate their experiences. So to make sure that we continue to engage with them. Some of the participants that I've worked with over the years, I still communicate with and I'm still engaged with. And although they might not participate in developing research now, they certainly influence some of the ideas that I take forward. And some references there. So happy to share my slides.
Thank you so much, Pat. And Manuel, do you want to introduce Rina?
Yeah, maybe we have time for 1-2 questions in between. Are there any? I haven't seen any question in the chat. So is there anyone who has a question to Pat? I have a question on the training and research methods, because we have done citizen science in a nursing home with staff and with nursing home residents. And what was really interesting, we took pictures from situations that are focusing on nutrition. And my experience is, if you have like very simple methods like taking pictures, it's like you get so much data that you are even overwhelmed as a scientist. So what is your experience?
Yeah, absolutely. I think the important thing is to give people the time to explain their opinions and views, because certainly when we're talking about older adults or older adults with dementia, you can't bombard them with ideas and expect them to then return their comments and questions. So I think timing is important. I also think things like pictures and information that is, written in a language that will enable them to understand. To give you an example, we've just developed some leaflets for people with learning disabilities who want to get involved in our research. And as you say, it's simple language, lots of pictures, not masses of information, but, things that can easily encourage engagement. So, yeah, totally agree.
I also had a conversation with the nursing home director 2 weeks ago, and he said, yeah, he also wants to engage his residents and staff much more in different topics without him as a leader, because there is this hierarchy. So I think like these citizen scientists, participatory approaches could also be used as management tools to get to know what is really the problem or the challenges from your staff without the boss is asking more or less.
Yeah, I think so. I think certainly in care homes, residents like a new face, and they like to engage with new people. And again, it's you can involve the staff, and I think it's important to go through the staff to make sure that you are talking to the right residents, that you're not putting too much pressure on them in terms of time, or you're asking the right questions. But the staff don't necessarily have to be there. The manager doesn't have to be there. They're busy people as well. So yeah, but totally agree, when residents like to engage with new people.
So is there another question? No. Then Rima, the floor is yours. It's about prioritization in care homes. What matters to them?
Okay, thank you so much. Can people hear me and can you see some slides? Yeah, thumbs up. Fabulous. So, hi everybody, and thank you so much for inviting me to be part of this webinar. My name is Rina Devi. I'm an associate professor at the University of Leeds in the UK. I'm also a scientific linking pin in a care and science partnership, and I'll tell you a bit about that. And I'm also part of the NIHR School for Social Care, which is one of the main funders for care-related research in the UK. And I'm going to talk about a study that we did where we identified research and practice priorities in the UK. So a bit of context before I go into the study. So Pat's outlined really nicely how important it is to work with the people who have lived experience of the topics that we're researching on. And so just a bit of context. In Leeds, we have a partnership called Niche Leeds, and that stands for Nurturing Innovation in Care Home Excellence. And the partnership model is based on the Dutch Living Lab model, which has had over, nearly 30 years of successful partnership working. And so our model is based on that, and we work together with care organisations to identify what really matters to people and where could research support with improving quality of life, care and work in care organisations. And so we start with asking them, what matters to you? What questions do you have? How might research support with addressing some of those questions? And so in my introduction, I mentioned that I'm a scientific linking pin. And what that means is I am based in a care home 1 day a week, and I work with these organisations to carry out activities that I've highlighted there on the slide. And so we worked throughout the research cycle, and Pat talked quite a lot about that. So we start with the questions that matter to them, develop research projects that are going to address those questions, conduct studies together, and then through to interpreting findings and dissemination. And so this is just some background to our partnership. A couple of slides here just to show how we're in the care homes. We have close relationships with our care partners, working closely with the staff, the residents, and the families. So this is just a bit of context about me and where I'm coming from in terms of our research, and it fits with the theme of this webinar around participatory research. So now I'm going to talk about the actual study where we identified research and practice priorities. So as I mentioned, a key part of our partnership is to start with those questions that matter to the people that live in care homes, the families and the staff. And so what we did in this study was we actually systematically gathered the questions and with the people in care homes prioritised which ones are the most important, i.e. which ones should we be focusing more on in our research. And so there were 3 key stages to this project. In the first stage, we carried out interviews with residents in care homes, their families and the staff. And these interviews took place in care homes in our partnership, so in the northern area of England called Yorkshire. And we started the study in 2020, early in 2020, and we were really happy with ourselves. We were on a roll, collecting lots of data, and then suddenly the care homes closed and we were in a pandemic and it was a disaster. So our data sat on a shelf for the best part of 2 years. And then once we were back in the care home, we could restart our study again. So phase 1 actually represents data pre and early post-pandemic. So in that way, we have quite rich data from phase 1. And so in phase 1, when we were doing these interviews, we were really trying to get at the heart of, tell me about what day-to-day life is like in a care home. What is it like to work here? What sort of questions do you have and what are your challenges? And then in phase 2, we organised that data through analysing and pulling out the key questions, and we organised these into broad themes and sub-themes. And we produced a survey from that data. And the survey was basically a prioritisation survey, asking people what themes and sub-themes are most important to you. And just to mention, we had paper-based and electronic surveys, which in phase 3, we had support from colleagues in Scotland and in Plymouth to distribute the survey in care homes across these parts of England. So, Scotland and northern and southern parts of England. And we were really pleased. We got a really good sample of participants taking part in phase 3. And so what did we find? So our participants asked a lot of questions. So our data set comprised 319 questions, and these were split into what we called research questions. So quite complex questions that require research to answer them. For example, what interventions support with reducing falls, or how can I support my residents to brush their teeth? So quite complicated questions, and we need research to address them. And then a small percentage of questions, so 45 questions, were what we called fact-based questions. So they're questions that matter to people, but they don't necessarily need research to answer them. One example that really stuck with me was, I remember a resident asking, oh, so on my TV, the font is so small. Can you make this font bigger so that I can read the subtitles? I can't hear, and I need subtitles to see what the TV program is about. So that is an important question, doesn't need research, but is something that the resident was asking. And so our questions, the 319 questions, they broadly fit around 3 broad themes, with resident care being the theme where there was the most questions. And so these were the prioritized sub-themes, and meaningful activities was a sub-theme prioritised by every single participant group, so residents, the families and the staff. And that was the only sub-theme that every participant group agreed was a priority. The other sub-themes listed on the slide, so recruitment and retention of staff, enjoying living in a communal space, support with emotions, and being treated with dignity and respect. These sub-themes were prioritised by at least 2 participant groups. And in our final paper, which I'll share the link to, we have a supplementary file where researchers can have a look at what questions actually come under these sub-themes. So more detail is in our final paper, but just to conclude, so in this study, we set out research and practice priorities, but importantly, these findings represent the perspectives of people living in care homes and the families, and the extent to which residents and families being included in priority setting has been limited to date. So this study helped to address that gap. And the findings can be used to assess where are the gaps and what do we need to be working on to help address these priorities. And there's a really broad range of questions, and it requires really close partnership working to address them. And we are exploring whether we can be kind of hosting a database of questions where people can submit questions regularly and we can treat it as a live database. We haven't yet set this up, but I'll be interested to hear if people think this would be a resource that they might use, and whether there's some demand for it, because we're not the only people working on in partnership working or working on priority settings. So there might be other groups with similar projects happening, and if we can collate together the questions that are being asked in care homes and the priorities, we can have an up-to-date database of that. So I'd be interested to hear what people think. So the full findings are available to read. I've obviously only just given a brief overview today, but just to thank you for listening, and obviously here and happy to answer questions. Thank you.
So thank you, Rena. Are there any questions, or are there any other people who are doing the same or similar things as Rena is doing? So prioritizing what should be done from the first step. So what is the most important question that we should answer?
Can I ask a question to the both Puff and Rena, because I was just looking for a theme that seems to cut across both, well, the presentations we had. Something that presenters didn't touch on, but maybe it's a cross-cutting theme, is research ethics and how you navigate research ethics given the nature of the research we discussed this morning. Do you have any comments on this?
How to navigate research ethics in care homes? Or, I mean,
using the approach and the methods you outlined, so which is maybe not traditional research in a sense, so you're not going in for an interview and walking out.
I think working with the care homes is really important, because they can help identify, are your methods appropriate? Is it going to work? What do you need to be thinking about? So people that might not be as experienced in the care home field, it's going to be really important to work with care home partners to identify what are the key issues that you need to be addressing in terms of the ethics. But I think there's quite a lot written already around ethics in care homes, and I'd be happy to send some links. Yeah.
Thank you. Pat, anything you want to add?
I was only going to add that, I mean, ethics in the UK is a little bit challenging to get approval, and I don't think that care homes present any more significant issues as long as you've got the staff on board, and the staff are happy that you're doing the research in their care home. So I think as long as you address the general ethical issues, I know we have specific social care committees in the UK, but sorry, I'm rambling a bit, but I think the ethical issues apply wherever you do your research, and as long as you address those, I think then it should be fine.
Maybe I can, it's just my thoughts from the Austrian perspective. Here it is pretty easy to get, do you hear me? Yeah, it's pretty easy to get an ethical approval for care home, so this is not the problem. And I think the ethical as a topic is not the problem or is the challenge. The challenge is to do research with people in a good way. And this is more the practical things. You have to think about maybe the one person is today, she is, I don't know, too tired. Tomorrow she is hungry. I don't know, whatever. So it just needs more time, as Pat also said, to not overwhelm them, overrule them, or things like that, because you want to have you have to have your sample size or whatever. So I think within the practical steps, you have to be very precise and think about the person as a person.
Which you would do with any ethical application.
Yeah. Are there other questions from the audience?
I have a small query. So hi everyone, I'm Swarnim Bajajare from Nepal, and I'm doing a research in caregiver burden, but not in care homes, but in community itself. So regarding the participatory approach, I wanted to know, what's the more plausible and more practical participatory approach to involve more of a caregivers than elderly in the workshop itself, because I'm developing an intervention to be implemented in the community. So what is the best approach or technique to be used for the participatory approach itself? Because there are different types of participatory approach that are in the time. Right now, I think there is a co-design workshop, and I was thinking of using one that currently in my research. But if there is anything else that's more possible with the community and the caregivers and elderly population, because you guys are more experienced than me on this field, that would really great advice actually.
So did I understand you right? Your question is about what is the best approach for engaging caregivers from the community, from an older population?
Yes.
In your, okay. So maybe Pat, you have an idea, because I think this would be your topic.
Yeah, I think the best approach is to advertise where older people attend groups and social clubs and whatever, and ask who's interested in getting involved, and then just make sure that you've got your group together and you provide them with the information, the training that they would need to be actively involved in the research. So in my experience, I did access various pain groups, community groups. I even went on Radio Scotland, which was very exciting. Not. You learn media training very quickly when you're doing participatory research, but it did work, so we did get participants.
So is your question answered?
Yes, thank you so much for that, and thank you so much for this opportunity as well.
You're welcome, of course. Is there another question from the audience?
Maybe Reina wants to come in.
Yeah, sorry, I was just going to add to the previous question, if that's all right. So I was just going to say the other key thing is, I think you mentioned you're working on caregiver burden. Is that correct?
Yes.
Yeah, and it seems like quite a potentially sensitive topic. So it's going to be really important to take the time to get to build trust with people, because I think sometimes when especially when the topic is tricky, people need to trust you before they can talk openly. So try not to underestimate how long that actually takes to build that relationship, people will talk openly and want to be part of it.
And thank you.
Catherine, do you want to come in?
Hi, yeah. Thank you. It's really, really interesting. I've got a question as somebody who does research, and obviously everything is sort of bound by funding. um, and what's come over loud and clear, and which is really obvious, is time and building in the resource of time, which is really important. But I was really interested because I suppose on two counts, because yeah, building time into your project to allow time to do it. But Pat was particularly saying, when the project ends, your contact with people doesn't necessarily end. So like how you manage that, how do you build that into a project where you get funding for a project for X amount of time? I suppose one question is how do you build in that extra time, or is that just something you take on and hope that you're still able to do that? And also, I suppose ethically, because we're sort of under the impression that you can keep participants' contact details for so long and then you're not supposed to have them. So, just wondering how you manage that. Thank you.
Yeah, I don't get funding to maintain that contact
No.
at all. I mean, you can get in your project, you can say you want to do a workshop or something at the end of the study, but it ends then, doesn't it? And no, I don't keep any patient details or contacts. I have to admit that if I've got a project coming up following on, then I would ask the participants if they're interested in continuing their involvement. But some of the participants are really social contacts now, that they get in touch with me, they know where I am. They're quite happy to drop me an email or give me a call if they've got a question, or what are you up to, is there something I could get involved in, sort of thing. So very informal, nothing formal, but no, I don't keep any details, I just
No,
think,
that's what I was thinking. So I suppose it's if they initiate that additional contact, then it's different to having a record.
Yeah.
It's
I know.
yeah.
I have to say, as a pain nurse years ago, I still have patients socially get in touch with me. It's just the nature of what we do, isn't it? You're out there, you're exposed, and people can get in touch if they've got a question or something. So yeah, but informal.
Thank you.
Rina, do you want to add anything?
Yeah, just to add to that, we have regular communications with people that are involved in our research studies, and in every communication we add text to say if your situation has changed and you no longer want to hear from us or take part in things, you don't have to tell us what's happened. Please just let us know and we'll take you off our mailing list. And I think this is really key as well, because some people want to hear about future research projects, and other people they're finished, and things in life have changed for them and they can no longer give that time and energy to it, and they just simply opt out, and we obviously respect that and delete them from mailing lists. But I think keeping in regular check and just having a mechanism where people can opt out is appropriate for this sort of thing.
Great. I think we are about to finish. So thank you everyone for joining today. Keep an eye on the communication from emails from the observatory for upcoming webinars, and we look forward to seeing you soon. Thanks.
Thank you so
Thank you.
much.
Bye.
Thank you.
Thank you. Bye.